And one of them being that there's a number of different fluids that can be tested. And I know that your paper kind of looked at this, kind of saliva versus urine versus blood. So what is sort of the best one to use?
So right now at the roadside, what is happens, I know in Canada for sure, I think it's similar in the US, is if a officer is suspects somebody of being impaired, they pull them over and they do a standardized field sobriety test, which is touching your nose and looking at the nystagmus and your ability to walk in the one leg stand, your balance and things like that, which we've all seen on TV. I'm sure we're a little bit familiar with what that looks like. And then they're also able to do at the roadside, and I know in Canada we use this, it's a saliva test that measures, it gives you a reading that says positive or negative if you're above a certain level or not. And then there's the blood, which they can take you back to the lab and they can look at the blood levels of THC as well. Then there's urine, of course, which is a bit of a different beast because with urine, you're measuring the breakdown products of cannabis. You're measuring what it comes off the cannabis, whereas with saliva and blood, you're measuring THC directly. So for that reason, urine probably isn't a great indicator of recent use. Also, as we know, these breakdown products of cannabis, of THC, can last in the urine for days, weeks, a very long time. So it is not a great indicator of very recent use. It just says that somebody has used in the past few days or potentially longer. Whereas saliva tells you more of a short time window in the past sort of 12 hours, and blood can give you a more definitive timeline. If somebody has very high levels of blood THC, then they've used fairly recently or smoked fairly recently. And if they're lower, then they would have used at some point in the past day or so. So that's more of an accurate time window for blood and saliva.
Right. And now, is it fairly easy to kind of look at the concentrations in the blood or saliva and sort of trace backwards how much cannabis the person could have ingested? Again, I'm sorry, I'm going to keep doing this. I'm going to keep kind of doing the comparison to alcohol, but if you're at like a 0.8 alcohol level, you can kind of go back and be like, okay, they've probably had a few drinks at least in the past hour or two. Can you do a similar thing with cannabis?
It's really to estimate the last time of use and the exact amount of use is quite challenging with cannabis because the amount of THC in blood and urine is really dependent on a lot of factors, including age, sex, how often you use cannabis, what form of cannabis you use. So we know that smoked and vaped cannabis produce very much higher levels very quickly in blood and saliva than with edibles, for example. But edibles last a lot longer than smoked. With smoked or vaped, it's gone in 5 hours. With edibles, it can last much longer. So if somebody comes up with 10 nanograms per mil of THC, it's really hard to know what kind of cannabis they used and when they last used it. Also, people who use frequently, the cannabis might stick around longer in the blood, urine, than people who use infrequently. So it's very challenging. We can tell you've used recently, but we don't know exactly how much or when that was.